Hello, I'm Dr. Khalilah Jefferson, DNP. Today I want to talk about an important leadership misconception in nursing, why being an excellent clinician does not automatically make someone an effective nurse leader. This is not a criticism of clinical excellence. Clinical excellence is essential. It is the foundation of safe, high-quality patient care. But leadership requires a different set of skills, behaviors, and responsibilities. In healthcare, high-performing clinicians are often promoted into leadership roles because they are trusted, knowledgeable, and respected at the bedside. That makes sense. However, research in nursing leadership consistently shows that technical expertise and leadership competence are not the same thing. Clinical excellence focuses on individual performance. Leadership focuses on system performance. A great clinician is skilled at assessment, intervention, prioritization, and patient advocacy. A great nurse leader must influence culture, manage conflict, support staff, allocate resources, and make decisions that affect outcomes beyond a single patient. These are fundamentally different cognitive and emotional demands. One major reason this transition is difficult is that clinical roles reward precision, while leadership roles require tolerance for ambiguity. At the bedside, there are protocols, standards, and immediate feedback. In leadership, outcomes are delayed, complex, and often influenced by factors outside one's direct control. Another challenge is identity shift. Many nurses define themselves by how well they perform clinically. When they move into leadership, their success is no longer measured by what they do, but by how well others perform. That requires letting go of control and trusting systems and people. Research also shows that new nurse leaders often receive little formal leadership training. They are expected to lead teams, manage performance, and navigate organizational politics with minimal preparation. This is not a personal failure, it is a structural one. Leadership skills such as communication, emotional intelligence, coaching, and conflict resolution are not automatically developed through clinical practice. They must be intentionally taught, practiced, and supported. Another critical difference is emotional labor. Clinical work involves emotional engagement with patients and families. Leadership adds emotional responsibility for staff morale, burnout, conflict, and psychological safety. Effective nurse leaders regulate their own emotions while supporting others, especially during stress, change, and crisis. Without preparation, even excellent clinicians can feel overwhelmed, isolated, or ineffective in leadership roles. The takeaway here is not that clinicians should avoid leadership. It is that clinical excellence is necessary but not sufficient. Strong nurse leaders are developed through structured leadership education, mentorship and coaching, clear role expectations, organizational support. When healthcare systems recognize this distinction, nurse leaders are more confident, teams function better, and patient outcomes improve. Leadership is not about being the best clinician in the room. It is about creating conditions where everyone can perform at their best. Understanding this distinction benefits nurses at every stage of their career. Thank you for listening.